Hello, welcome back in Pharma Training Solutions. That will be briefly explaining the antimycobacterial or the anti-TB, and at the end I'll explain drugs which are used in management of leprosy. Now, of course, we know that TB is a chronic infection caused by Mycobacterium. Tuberculosis commonly affects the lungs and can also affect other organs such as lymph nodes, bones, meningitis. No, I'm not talking about the signs and symptoms. Those ones I'm sure you're aware of. I am in pharmacology. You can cover them in therapeutics. Now, the cell wall contains complex lipids about 60% with mycolic acids. And these are the ones responsible for almost the resistance. Drug which are used in management. The first line we have isoniazid, rivampin, pyrazinamide, ethambutol, and streptomycin. This is, of course, streptomycin and kanamycin. This is aminoglycoside. The second generation we have cycloserine, kanamycin, amikacin, capreomycin, etionamide, p-aminosalicylic acid, and others. Now, of course, INH or isoniazid is a prodrug, and it inhibits synthesis of mycolic acid. Side effects to have peripheral neuropathy. This one is managed by giving vitamin B6 or pyridoxine tablets, 25 milligrams OD. We also have immunologic side effects such as fever, skin rash. It's also hepatotoxic and jaundice. Now, if it is given with DTG, the ARV, they have problems. Now, also restlessness. Now, rivampin, it binds to bacterial DNA dependent RNA polymerase and inhibits RNA synthesis. It's called skin rashes, jaundice, at the same time red-orange metabolites or orange urine. Now, when patients complain of this, it's good to tell them, you just reassure the patients. Because sometimes they ask you what states classify anti-TB, the mechanism and the side effects and how they are managed. Now, ethambutol is also used. It inhibits arabinosalide transferase involved in synthesis of arabinogalactan. Now, side effects can cause visual disturbances. Pyrazinamide, remember I'm very fast. I'm sorry. But the mechanism of action is unknown, but it causes GI irritation, fatigue, and hyperuricemia, and it can provoke gouty arthritis, or what we call joint pains. And of course, you manage it using NSAIDs such as ibuprofen. Now, aminoglycosides such as streptomycin, amikacin, the fluoroquinolones, levofloxacin, they're also used. Of course, the second line or first line for streptomycin. Now, these ones refer to our presentation of protein synthesis inhibitors. You get more information. Etionamide is related to INH, side effects of severe GI irritation, hepatotoxic. P-aminosalicylic acid can also be used similar to PABA, inhibiting folic acid synthesis, but causes severe peptic ulceration. Most of these are rarely used. Others such as capreomycin, cycloserine, rifabutin can also be used. Now, leprosy, of course, is not leprosy. Leprosy. It's a chronic infection caused by Mycobacterial repro, managed by sulfones, dapsone, is related to sulfonamide and it inhibits folate synthesis. Acedapsone is a repository form. It's a long-acting. It is given termostal and long-acting, so it is a repository. Now, others which are used, we have rivampin, clofazimine can also be used in leprosy, interact with DNA and used in sulfone-resistant leprosy and when patients are intolerant to sulfone. Remember, this has been a short presentation on antimycobacterials and lepre. These are the others which we have in chemotherapy or the antibacterials, the others, antivirals. Always refer to them. I always remain Wilson from Pharma Training Solutions. Always contact us for more information. In case you already subscribe to our channel, subscribe to it, give us a thumbs up, contact us on the email and WhatsApp, shall always reply, leave a comment, and thank you very much.